nothing in biology is free, you guys, right? And just based on the pharmaceutical companies' track records, I don't trust anything that they put out there. So I can basically guarantee you that there's going to be massive, massive problems with this drug, and it's going to be taken off the market. My name is Jason Schuster. I'm a doctor of physical therapy. I own Intricate Arts Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple things to improve the health of their patients and their own health and the health of the population in general. One of the things that the FDA is currently doing right now in 2024 is this is the practice of our public healthcare system, you guys. So anything that's natural, the government can't patent. The pharmaceutical companies and the government can't patent natural materials, right? It has to be changed a certain amount before they can patent it. So when there's natural molecules like vitamins, minerals, and peptides that show massively helpful health effects that are the overwhelming percentage of the time way more effective and way safer than pharmaceuticals. When they find stuff like that, they make a huge media campaign and they tell the public that it's super dangerous. They put a black label list on it. At the same time, they put hundreds of millions of dollars into research. And then when they can change the molecule enough, right, and they can get a patent on it, all of a sudden it's safe again. However, what they've done, if they've taken a natural thing and changed it enough where it's not natural anymore, and that's what causes side effects and all these problems. So a really, really good example of this, you guys, is Ozempic. So I know there's a lot of like positive talk about Ozempic out there, and people losing weight is a good thing, but I can guarantee you guys right now that drug is going to be taken off the market, just like about 33% of all pharmaceutical drugs put on the market are taken off the market because of safety issues, right? So should you trust somebody where 33% of their product is deemed not safe for human beings to take after they give it to millions of human beings, right? So when the FDA and the CDC and all these things, they are trying to ban certain supplements and certain peptides, or most peptides, because they can't patent them. So what Ozempic is it's based on the peptide semaglutide, you guys, right? It's a GLP-1 agonist. It basically slows down the rate of your intestinal tract. It slows down your digestion, which alters the amount of leptin and ghrelin hormones that you have, which changes how hungry you are, so people just eat less. So number one, for all of the idiot doctors out there who like to say that obesity is not a calories problem, well, 100% of doctors I know will say that Ozempic works because it makes people eat less. So if people lose hundreds of pounds on Ozempic because they're eating less, why don't you just eat less? Right? So all these doctors that say that it's not just eating less, well, apparently, you guys, it is actually just eating less, right? I'm not saying there's other issues that people have, but it is literally scientifically impossible to not lose weight if you consistently put fewer calories into your body than you burn during the day, right? So if you burn more calories during the day than you put in, over time, it is scientifically impossible to not lose weight, right? So one argument that people will make about this is, well, not all calories are the same. That does not change the equation that if you burn more calories than you put in, you're going to lose weight, right? So they say not all calories are created equal. Some calories take more energy to burn than others. That's for sure true. That's one of the main reasons that processed food is so detrimental to people, because your body doesn't view it as food. It's like some alien substance, so it's trying to deal with it and it can't, and your body just can't do the stuff that it needs. So those calories do require more energy to burn than, say, a calorie of steak. A Twinkie calorie takes a lot more energy to burn than a calorie of steak, right? However, that does not change the fact that if you burn more calories than you put into your body during the day, you lose weight, right? It is a simple addition and subtraction problem, right? This is not an arguable fact. So, number one, Ozempic is treating a problem that is, it's a massive problem. 80% of the United States is obese, you guys. So obesity is a huge problem. So I'm a little bit divided on, like, you got to look at the risk reward ratio. If you're 300 or 400 pounds, if you lose 200 pounds, whatever negative side effects you get from Ozempic, is that worth it as far as overall health outcomes? Because being obese is one of the most detrimental things you can do to your overall mental and physical health that there is. So it just depends on the severity of the side effects, but nothing in biology is free, you guys, right? And just based on the pharmaceutical companies' track records, I don't trust anything that they put out there. So I can basically guarantee you that there's going to be massive, massive problems with this drug, and it's going to be taken off the market. And the fact that this is now, per the pediatric societies and per mainstream medicine, Ozempic is the standard of care for children. What Ozempic is doing, you guys, is it's slowing down, it's turning off your parasympathetic autonomic nervous system. So your parasympathetic autonomic nervous system is typically the part of the nervous system that people think about when they think about, so there's the fight or flight response, right? And then there's rest and digest. So in general, the parasympathetic is a calming part of the nervous system. The sympathetic nervous system is a more excitatory part of the nervous system. So when we're sleeping, our parasympathetics are on more. When we're scared, playing sports, and just awake in general, our sympathetics are on more. Now, the typical human reaction to anything, stressful, painful, anything like that, is to elevate the sympathetic nervous system. What happens when you elevate the sympathetic nervous system is that inhibits the parasympathetic nervous system. So the sympathetic nervous system is like a seesaw, you guys. As far as we understand right now in medicine, both sides of the seesaw can't go up or down at the same time. One side goes up and the other side goes down, right? This is how we understand the sympathetic nervous system to work right now. So if the sympathetic side of the nervous system goes up, the parasympathetic side goes down. If the parasympathetic side goes down, the sympathetic side goes up, right? If the sympathetic side goes down, the parasympathetic side goes up. It's just a reciprocal relationship. Ozempic is slowing down the parasympathetic autonomic nervous system. That is the only way that we can slow down our digestion, right? So that's one of the reasons that people get constipated when they're stressed out and stuff like that, is your sympathetics go up more. That inhibits your parasympathetics more. That slows down your digestion, causes you to get constipation. It is vitally important for our autonomic nervous system to be more or less neutral for most of the time. It's obviously going to be different when we're playing a sport or something like that, or going through like some physical activity. But more or less, it should be bouncing back and forth. It's going to be a little bit more on during the day. The sympathetics, the parasympathetics are going to be a little bit more on at night. However, if you're chronically living, and this is how most Americans are already living, because if 80% of the United States is overweight, obese, or morbidly obese, you guys, and those are the statistics per the CDC, right? That guarantees you that 80% of the United States population is already living with chronic sympathetic autonomic nervous system hyperactivity, which is one of the most common underlying causes of all chronic, idiopathic, and autoimmune diseases, right? So there's very, very few actual idiopathic diseases. Although basically all diseases in the United States are considered idiopathic, it's because the people trying to treat these things, you guys are fucking idiots, right? So if you never look for the cause of the problem, right? So this is what they're doing with Ozempic, right? Rather than treating people nutritionally, which mainstream medicine has neglected to do and continues to not do at all, period, right? If you neglect to treat people nutritionally, which is the underlying reason that people are obese and fat, right? You guys, it is almost impossible to be significantly overweight if you just don't eat processed food at all. Like, I don't eat processed food, right? I've never been overweight in my whole life, right? People that don't eat processed food are not overweight. Period, end of story, right? You would have to be in a less than 5% of the population to have some type of deal where theoretically your body would just want to be overweight. Basically, nobody has that. People have different tendencies to be more likely to put on weight than others, right? But that just takes knowing how your body is and regulating how you eat and what you put into your body accordingly. If we had the proper doctors out there, like a great guy, you guys, is Dr. Hyman. He owns Function Medicine. That's one of my favorite companies. So Function Medicine is a great functional health company. They do excellent blood testing. Really, really awesome company. I'd recommend anybody to go and use their company. So this is another example, you guys. So the standard comprehensive blood panel is the same blood panel that was being used in the 1950s. So our standard of care blood panel in 2024 is literally the same standard of care blood panel that was used in the 1950s, right? As if we've learned nothing in medicine over the last 70 years or so, right? So the standard comprehensive blood panel primarily tests for things that indicate organ problems, but they only indicate problems at like the end stage of the problem. They don't pick up on like early stage problems or subclinical problems, right? Which is not by accident. So the pharmaceutical companies in our public health system want people to be subclinically ill with vitamin deficiencies and all these things, so they always have these recurrent injuries and problems throughout their life, so they always go and take these pills and make the pharmaceutical companies money throughout their life, right? So Dr. Hyman's company, the standard comprehensive blood panel, it tests for 14 blood markers. Dr. Hyman's company, Function Health, tests for 134 blood markers, right? So I don't know about you guys, but I would rather know about 134 things in my body than 14. And those 14 are included in that 134. So it's not like you have to decide between one or the other. So that's a private company in which health insurance is not accepted, because health insurance is basically, health insurance is ruining medicine. It's one of the things that's ruining medicine, right, you guys? So unfortunately, and this is a horrible thing, but if you're using health insurance for your health care, it's almost a 100% guarantee that you're getting treated like crap, right? Because the doctors that are working in mainstream medicine have about like 2 to 5 minutes to see you. They never have a chance to think about anything. How health insurance companies reimburse doctors dictates what treatments they provide for their patients, right? So if they just have a couple minutes with their patients, they're gonna do the treatments that make them the most money, and that's it. And those treatments just happen to never make people better and cause people lots more problems. Again, all you have to look at are the objective facts, you guys. Every single chronic disease that mainstream medicine has touched has gotten exponentially worse throughout my lifetime. Period. End of story. Not a single thing has gotten better.